Namaskar, hello, and a very warm welcome to this live phone and interactive program. My name is Tanvi Khurana, and at this moment you're watching us on eVidya channel number 9, 10, 11, and 12. Well, Department of Science and Mathematics NCRT brings you our National Student Outreach Program, that is Pravasi Bharati Academic and Scientific Sampark, that is integrating Indian diaspora with the motherland. This is our special series, and in this special series, we are here with our webinar series, that is Listening to Learn. And today we have entered into session number 48 for all of you. This is a science-based program, and we come here twice in a month on Fridays sharp at 10, and we discuss a topic related to science. We have so far discussed a lot of topics related to medicine, be it wind tunnel, be it James Webb telescope, and a lot more. And today we are going to talk about the topic that is radiology in the service of mankind, जिसे हम हिंदी में कहेंगे मानव जाति की सेवा में radiology. If you have any questions, any queries regarding this topic, please reach out to us. आप हमें फ़ोन कर सकते हैं. हमारा नंबर है 8800440559. इस वक्त आप हमें लाइव देख रहे हैं हमारे YouTube चैनल पे, जो कि है NCERT ऑफिशियल. उसके लाइव चैट बॉक्स में भी आप अपने सवाल लिखकर हम तक पहुंचा सकते हैं. 11 बजे तक हमारे साथ यहाँ कुछ मेहमान मौजूद हैं. आपसे बहुत सारी बातचीत करेंगे रेडियोलॉजी इन द सर्विस ऑफ मैनकाइंड पर, और अगर आपके पास कोई सवाल हैं तो हम उन्हें लेने की पूरी कोशिश भी करेंगे. हमारे साथ कुछ मेहमान हैं, तो आइए आपको इंट्रोड्यूस करवाते हैं डॉक्टर आनंद मोहित से. A very warm welcome to you, sir.
Namaskar. Thank you.
And we also have with us Dr. Gagan Gupta. You all know him very well. Welcome, sir. So, sir is the host of this particular program, and as you know that this is not an ordinary program. आप कहीं भी हैं दुनिया में, आप इसे देख सकते हैं हमारे YouTube चैनल के माध्यम से, और हमसे जुड़ भी सकते हैं. और इस कार्यक्रम को शुरू करने से पहले हम आपको कुछ इम्पोर्टेंट सूचना भी देना चाहेंगे, और वो है परीक्षा पे चर्चा से जुड़ी हुई. आप सभी जानते हैं कि आज 27 जनवरी है और आज ही है परीक्षा पे चर्चा. इस कार्यक्रम में आप सुन सकते हैं प्रधानमंत्री श्री नरेंद्र मोदी जी के जीवन के मंत्र, और किस तरह परीक्षा को उत्सव मनाया जा सकता है वो भी आपको बताया जाएगा. इस कार्यक्रम में माननीय प्रधानमंत्री जी सीधा संवाद करेंगे विद्यार्थियों से, शिक्षकों से और अभिभावकों से. इस कार्यक्रम का सीधा प्रसारण आप देख सकते हैं दूरदर्शन के सभी प्रमुख चैनलों पर, ऑल इंडिया रेडियो पर, eVidya चैनल नंबर 1 से लेकर चैनल नंबर 12 तक भी. ठीक 11 बजे इस कार्यक्रम की शुरुआत होगी, तो देखना बिल्कुल मत भूलिएगा. साथ ही साथ of course you all know about the G20 presidency, so we are very proud that India assumed G20 presidency and will convene G20 leaders summit for the first time in the country in 2023, that is this particular year. A nation deeply committed to democracy and multilateralism, well, India's G20 presidency would be a watershed moment in her history, as it seeks to play an important role by finding the pragmatic global solutions for the well-being of all, and in doing so, well, manifest the true spirit of Vasudhaiva Kutumbakam, or should I say, the world is one family. With that, let me please ask Dr. Gagan Gupta to introduce our special guest who is here with us in our studio, Dr. Anand Mohit. Sir.
सादर प्रणाम दोस्तों. आज का ये प्रोग्राम 48वें पड़ाव पर है, और आपको याद होगा कि अगस्त 2021 में ये प्रोग्राम की शुरुआत हुई थी. इस प्रोग्राम की शुरुआत हुई थी हमारे साथ काउंसिल ऑफ साइंटिफिक एंड इंडस्ट्रियल रिसर्च CSIR न्यू दिल्ली के कोलैबोरेशन में, और डॉक्टर आनंद मोहित तब हमारे साथ कई दफ़ा हमारे साथ थे. आज एक बार पुनः हमारे साथ हैं. आज मेरी जिम्मेदारी है two young men from India to be introduced in this program. One is sitting just besides with me, and another is sitting in Liverpool, United Kingdom. So today's session, which is on radiology in the service of mankind, will be delivered by Dr. Abhishek Mahajan, who has been a professor at Tata Memorial Hospital in Mumbai and now in Liverpool. So we are thankful to the Cambridge Cancer Institute, Liverpool, for collaborating with us, and of course we are thankful to Dr. Anand Mohit, who is from the CSIR headquarters, New Delhi, So welcome, Dr. Mohit.
Thank you.
To this program. It is your own program, so we share
Yes,
the
we
responsibility of this program together.
Yes.
So we had many sessions, and we will be having many sessions for them to come on. So today, as my friend Tanvi said, that we are tight in schedule. So without saying much, I request you to please keep on posting your questions on your NCRT's YouTube channel, NCRT official, in the chat box. And I request Dr. Mohit to welcome Dr. Abhishek Mahajan and to introduce Abhishek Mahajan to the audience, please.
Thank you, Dr. Gupta, and thank you, Tanviji. A very warm welcome to you, Dr. Abhishek. For our speakers, I would just quickly introduce radiology, and then for the benefit Dr. Mahajan. Radiology is a branch of medicine that uses technology, imaging technology, to diagnose and treat diseases. Radiologists play a vital and important role in your health by acting as an expert consultant to the physician or the surgeons. This talk today aims to describe situations where diagnostic and interventional radiology procedures are useful. Notable Indian onco radiologist, Dr. Abhishek Mahajan, is presently a consultant radiologist at the Clatterbridge Cancer Centre NHS Foundation Trust, Liverpool, United Kingdom. He obtained his MBBS and MD degree from Kasturba Medical College, Manipal in 2005 and 2009 respectively, and his Masters of Research degree from King's College, London in Translational Cancer Medicine in 2014. He also was awarded by the Fellowship in the Cancer Imaging in 2011 and Fellowship of Royal College of Radiologists, United Kingdom. His research interests include artificial intelligence, radiogenomics, and biomarker imaging, malignancies in head and neck, and neuro and thoracic imaging, etc. Dr. Mahajan has authored more than 350 research publications and several book chapters, and has edited textbooks on oncology imaging. He has also delivered more than 200 national and international faculty lectures, and has been a principal investigator of over 21 clinical trials, and also a principal investigator for setting up imaging blood bank lab at the Tata Memorial Centre, Mumbai. He has developed cancer imaging protocols for pregnancy as well. He is an associate editor of several journals like Frontiers in Oncology, Frontiers in Nuclear Medicine, and Frontiers in Radiology, and a member of numerous professional bodies, and an educational committee member of World Molecular Imaging Society. He is a recipient of many awards: Artificial Intelligence Innovation Award, Best Clinical Researcher Award 2020 by the International Society for Magnetic Resonance in Medicine, and Indian Express Medicine Imaging Awards 2018. Without much ado, we request Dr. Mahajan to please kindly deliver your address.
For the benefit of the benefits, please, our viewers, please note that all the images which are going to be used, which are going to be screened today, belong to Dr. Mahajan, and these are copyright material, please. So, Dr. Mahajan, please.
Thank you everyone. Thank you Tanvi, thank you Mohit, and thank you Dr. Gagan. It is a pleasure and honor to speak to the young nation. I'm really excited to talk here, and it's an opportunity given by CIET and CISR. I'm really thankful. मेरा धन्यवाद आप लोगों को मुझे ये opportunity देने के लिए. And without further ado, I would start my talk on this topic, which is radiology in the service of mankind. ये टॉपिक मैंने इसलिए चूज किया जस्ट टू ओरिएंट आप लोगों को कि रेडियोलॉजी क्या है, एक रेडियोलॉजिस्ट क्या करता है, व्हाट इज अ रेडियोलॉजिस्ट, एंड हाउ डू वी एक्चुअली प्ले एन इंपॉर्टेंट रोल इन दी ह्यूमन मैनकाइंड हेल्थ सिस्टम. So through this talk, I would like to engage you and involve you and orient you what we do and how do we help the mankind in the healthcare system. If you all know, science was very primitive in the beginning. This is a picture taken from Laennec, who developed the first stethoscope. Stethoscope was the first diagnostic instrument used in medicine to hear or to listen to the body. And this is how this tube would be kept on the chest to hear any chest symptoms. You can see this primitive stethoscope. It's an invention on its own. And that was the beginning of diagnostic medicine. Earlier, it used to be just hear to the symptoms of the patient पेशेंट के सिम्टम्स को सुनिए और उनके बेसिस पे आप एक डायग्नोसिस दे दीजिए. बट विद द डायग्नोस्टिक मेडिसिन things change rapidly. The number of patients who were dying reduced. The diagnosis was earlier. So what diagnostic medicine is to diagnose a disease at an earlier phase, to intervene early, to give good quality medication and improve the survival or the life of the patient. So from that stethoscope, now you can see this is the modern stethoscope, and this is one of the cherished stethoscope every medicine student wants to buy. It's called Littmann, and it's one of our things when we enter medicine. This is the first, I would say, jewelry which we buy in the medicine. And it plays an important role in the life of a doctor. How do you recognize a doctor from a technician is with this stethoscope. So this made a revolution. But this revolution was incomplete without peeping or seeing inside the body. Actual live viewing of the body was still a mystery. And that got solved in 1895 with this man called Wilhelm Conrad Röntgen. He is the father of radiology for us, who invented the X-rays, and that was the biggest invention in the history of medicine. He was awarded Nobel Prize, a German physicist who used X-ray tubes using cathode and anode, a simple physics instrument over here. That's his X-ray tube. He passed the electricity, the electrons moved from cathode to anode, and they bombarded some rays which were used to read the human body. So this is Wilhelm Röntgen, and he used his own wife's hand to image. You can see the wedding ring on the hand, and this is the first radiograph he took. It took 30 minutes to take this radiograph. He radiated so much that even it got some injury. This was the first X-ray which was taken in 22nd December 1895, and he published this paper saying that there is something called as X-rays. They were called X-rays because nobody knew what are these rays, and they could go through the body and they could project the body on a film. So this is the actual film of the Mrs. Röntgen with the wedding ring on it. And then there is something called as Nobel Prize. It's given in Karolinska University in Oslo and Stockholm. So Alfred Nobel is named on the name of Alfred Nobel, and Wilhelm Röntgen was awarded this award in 1901. So until then, things didn't change much. In few years, America took lead over it. They created a first the diagnostic X-ray tube. So until the invention, it did not reach the clinic. It reached hospital and clinic in 1905 when it made history, and the first X-ray was taken. So you can see the fracture of the bone over here. They are sitting, and the hand is kept here to take the X-ray. This was the first radiograph taken. And that became the journey of radiology. Radiology, when it started, it was quite primitive. It only relied on X-rays for a very, very, very long time. X-rays were the only source of imaging inside the body, and that's how the normal chest X-ray looks. You all know recently we all got affected by COVID, and it changed so much. So this is how X-rays were used to diagnose COVID. You can see the changes in the lung, the lesions in the lung, and this is how we intervene. So in the recent time, you can see how radiology became suddenly important, or medicine became important after this epidemic of the COVID, that the first point of diagnosis was chest X-ray or CT scan, and then RT-PCR. So diagnostics is the most important field in medicine which help any clinician to make a diagnosis. So any smoker, we can do a chest X-ray, look for a mass inside the lung, and this is a lung cancer which is seen over here. So this is how we make diagnosis in cancer, in infections, in other areas. Not only that, a patient who's had trauma, we look inside using X-rays, see if there are fractures of the bone, if these fractured bones are displaced, or they can be treated or not. After nailing, after reconstruction, or after putting nails and rods inside, we again take X-rays. This is helpful. Not only that, every eminent figure in the history has gone through diagnostic radiology for better treatment and better outcomes. Dr. Atal Bihari Vajpayee ji who suffered from osteoarthritis of the knee, was treated in Mumbai at Beach Candy Hospital. And this is the replacement which he underwent. You can see the knee replacement of the osteoarthritic knee, which made life better for any. And this is a common scenario which we see in our day-to-day practice. हमारी आम जिंदगी में हमारे माँ बाप, हमारे बुजुर्ग जो इस डिजीज से जूझते हैं, hip arthritis, knee arthritis, we use X-ray to diagnose and also to follow up of these patients. You all know this, you guys are young, but when we were growing up, we used to see this movie Anand, and the first thing which the thing which is said is lymphosarcoma of the intestine, and you suddenly wonder what is this lymphosarcoma, and then they put this barium film. So we also give some kind of contrast, which is barium. Barium is something similar to bone. It does not let X-rays pass. And that's how we look in the intestine. So this is a typical case which I just wanted to show how the barium looks. But if I was to treat this patient just on the basis of barium, it was so difficult. And then came CT scanners, which I'll show in the subsequent part of the lecture. So it just did not stop there. So the X-ray was giving a static image. It was not real time. And people thought we should constantly bombard X-rays and see something real time. And there, Dr. Walter made an innovation. He created a film which could rotate. So in the movie halls, you see there's a film going round and round, and it is projecting a film on the screen. Similarly, similar film was used at a speed to do live X-rays. So this made this fluoroscopy room. You put the patient here, you give live X-rays, and constantly look into the images of the inside the body, and that becomes fluoroscopy. So this is a fluoroscopy image of the gastrointestinal system. This is the stomach, duodenum, small bowel, large bowel, and it helps in making many diagnoses. This is an example which I'm showing over here is ascariasis of the intestine, roundworm infection, or जिसको tapeworm भी बोलते हैं. So you can see the worms inside the body. We can pick this, diagnose, and treat these patients quickly. The cancer of the colon gives a very classical appearance of apple core deformity, and you can see the apple core over here. So we name quite a lot of signs in radiology. ये एकदम एप्पल के खाया हुआ एप्पल के जैसे दिख रहा है, ये ट्यूमर का पार्ट है जो कि नली को बंद कर रहा है. The lumen is getting obstructed. So with this live radiography came angiography. If you can see constantly, it becomes angiography. And आपने बहुत बार सुना होगा कि बहुत पेशेंट एंजियोग्राफी के लिए जाते हैं जिनको दिल का दौरा पड़ा है, कार्डियक अटैक, और they have had stroke. So these are common areas where angiography, and I think many of you would have heard this angiography terminology. It was invented by Sir Evan Sildinger. Angiography is a minimally invasive technique where you put a small tube inside the body and then image the whole system. So this was the first angiogram in the history of radiology which was taken of the hand using injecting mercury in a post-mortem, in a dead person. So this was post-mortem angiography, and it was done using mercury. And this is the current angiography machines which can do many reconstructions, high-quality images. And you can see now here, this is how an angiogram looks. This is the angiogram of the heart, where the contrast is injected directly into the coronary artery, one of the arteries of the heart, and then you can see the arteries pick up the block, treat the block. And this is the angiography of the brain, where you can see the carotid arteries and the veins and everything, which helps us into treating stroke and cardiac patients. Female, we all have a female figure in our life, a mother, a sister, a wife, and females suffer from a very typical disease, which is breast cancer. And these are some surviving females who've made history of being legendary in their treatment, have become brand ambassador of breast cancer and cervical cancer. So we as radiologists play a very important role, and something called as mammography is an important tool to diagnose the breast cancer. In mammography, you have the same X-ray equipment, and then you press the breast between the two areas to compress the breast like a ball, and then take a radiograph. And it is a very important tool to diagnose cancer. You can see the cancer is so well seen here. And at the same time, I would urge every one of you should promote breast cancer screening in your family. Ask the female in the house to go for routine checkup, screening. And this is my earnest request to everyone who's listening this lecture to make sure that breast screening is followed in the family cycle. Just look at the figures, how many people. We have 1.38 million new breast cancer patients. Every 4 minutes, an Indian woman is diagnosed with breast cancer, and one woman dies every 13 minutes. That's a very high number. So if detected early, this number of deaths can be reduced. Sometimes in younger patients, we use something called as ultrasound, which is different. So all these X-rays have ionizing radiation, and these ionizing radiations can have some harmful effects, but not that big. Somebody thought, okay, let's use something different, and then came the Ludwig's tool, which was the first ultrasound where he used the sonic wave to peep inside the body. So what happens is there is a ultrasound probe over here. We give ultrasonic waves and they pass through the body and we see them on the images. This is a typical ultrasound of the current era. It's commonly used in looking at the babies, how if they are fine, because number of anomalies were picked. If you pick any anomaly, the growth of the child, if the child is growing healthy or not. Even echocardiography is also an important tool which uses the ultrasound as a tool to look inside the heart. This is a video of the heart where you can see the chambers of the heart, and this is a child where you can see live the beating heart of the child by doing an ultrasound. The ultrasound can be converted into 3D ultrasound, and in some centers they even use to identify boy and a girl, which is not done in India. It is against the rule. It is against to do sex determination using ultrasound, and it is because we've seen feticide being happening, and I again request that this should not be practiced. This is not ethical. Everybody is equal there. There's no need, boy or girl is equally equal, and there's no need to do sex determination, and this is against the law of PCP and DP. From there, the history moves on further, and then comes the newer thing, which is Doppler. We all have read Doppler phenomenon in physics. If a sound is moving fast, it can give a signal, and that can be read. So this phenomenon we use to look inside the blood vessels, and this is a Doppler of the blood vessels. You can see how the vessels are, if the vessels are patent, if there is any block inside, we can use Doppler to check that. And then comes the major innovation in the history of radiology, that is the CT scan. Dhirubhai Ambani suffered from stroke, which bled, and this was one of the highlights to show how people's life have been changed by not having adequate imaging at the right time. So this was the first CT scanner. It was developed by the EMI Limited, and the person who we should thank is Sir Godfrey Hounsfield. And it was presented at the British Institute of Radiology to do CT scans. So what we do in CT scans is we give some contrast. Patient lies inside the gantry or the CT equipment. The machine goes inside, and then there's a scanner which scans. So there's an X-ray tube and reader, and it scans the body. And this is the first CT scan of the brain. It took 25 minutes to take one slice. And now within seconds, we can look into the brain of the patient. And this is how a modern CT scanner looks. CT scan again changed the full era of COVID. And many patients, you would know, had CT scans. This is just to highlight from my published work. We developed a machine learning algorithm to automatically detect these lesions because there was shortage of radiologists. And we wanted something automated where the machine would definitely tell whether it is COVID or not. So this is one of the major applications in the recent time. You would have noticed how CT scans have changed the whole picture of treating patients. And this is some of the published work we published on the pandemic, where we highlighted how pandemic can be managed using imaging adequately. Apart from that, the CT scans help into picking trauma. This is the CT scan of the brain. You can see the blood here. It is a trauma patient, fracture of the skull. And then comes our eminent figure, who doesn't know Amitabh Bachchan ji. and he suffered from colitis. At that time, he underwent CT scan, and you can see that he had major involvement of the bowels and guts, and it was adequately treated at the right time. So having imaging tool in hand becomes very important. Not only that, there is something known as cardiac CT, where you can see the heart, look at the vessel, treat them, look at the calcification, atherosclerosis, kitna block hai, sab check kiya ja sakta hai. Not only that, we even do CT scan for liver cancer, look at the liver cancer, soft tissue. We can do so many things now with radiology and with the newer software that we can reconstruct, do 3D and tell the surgeon how big is the tumor, how much he has to resect, how long would the surgery if the tumor size is this. This is another invention in CT which is called as virtual scopy. You might have heard of colonoscopy, upper GI scopy or bronchoscopy, where the surgeon would put a tube and a camera inside the body, which is quite painful, but using CT scan we can do virtual scopies. What we do is we give air inside the body and scan the patient and start looking inside the colon or in the bronchus. These are newer innovations which has definitely changed and made life easy for patient, because it is very challenging for patient to undergo these scopy experiments. And then because all these techniques you've seen, they are still evolving. And then I present this Randeep Kapoor ji, who's recently been diagnosed to have dementia. Dementia, as you know, is again a very common illness which every elderly person is going to face at some point of time. Some form of dementia always comes in with aging. So dementia is mostly diagnosed with MRI. This is the normal brain MRI. You can see how nicely the brain looks, and this is shrunken brain. The brain starts to shrink with age, and once that shrinkage starts to take place, the brain function and the memory decreases over a period of time, and that is presented as dementia. So when a patient comes with the signs of forgetfulness, we do an MRI of the brain to see whether it is dementia or it is related to something else. So it's very important to image these patients. And this is the history of MRI. MRI started somewhere in 1938, which was NMR, and then there was series of developments. Finally, Lauterberg, who's the father of MRI, got Nobel Prize for this invention, and this is the first MRI equipment. So what MRI is different from CT scan is the CT scan works on ionizing radiation from an X-ray tube, but in MRI we have magnetic field. We use magnetic rays and they vibrate the hydrogen proton within the cell, and the vibration of the proton is actually read by the receiver, and that is converted into image. Just imagine how much technology has advanced. Using the proton inside the body and the magnetic field around us, we could create images. So this is the magnetic resonance imaging machine looks. There is the patient goes with inside. He's covered all along with a strong superconducting magnet which gives magnetic rays, and that is read by the receiver, and this is a typical MR equipment. And this is how MRI is different from CT scan. MRI uses something called as the principle behind its technique is that it gives very nice soft tissue, means muscles अच्छे से दिखता है, और कहीं पे भी छोटे कैंसर हैं वो ज़्यादा बढ़िया से दिखते हैं. So this is a common problem with many players, cricketers, that MRI is commonly used to pick the injuries. This is Javagal Srinath and many other bowlers. They suffer from something called as rotator cuff injury. It is the injury of one of the muscles along the shoulder joint, which is nicely picked on MR. Till date, we didn't have any tool to pick this, and this early, if it is picked early, it is treatable, but if it is late, big tear of the muscle, it is a challenge for an orthopedician to treat it. Apart from this, where I worked at Tata Memorial Center, we see a lot of patients who have cancer. The brain tumor is one of the most challenging area to treat, because you don't open the brain and then feel, okay, I can't operate it. But see how technology has changed. We can even mark the fibers, the gray matter, the white matter, all the neurons of the body. And this is how the fibers are mapped tumor can be reconstructed. Before the surgeon goes in, he already knows how to or where to go, how much to take, what not to touch, what to touch. And we also can even tell whether the tumor is affecting hand movement or vision of the patient. It's all can be done using imaging these days, the MRI. MRI has also revolutionized the field of cardiac patients, and this is how a patient who has suffered a cardiac attack, we can tell what part of the cardiac muscle is not functional. Not only that, you know something in science, you would have read spectroscopy. Spectroscopy is looking at the molecular composition of any compound or a chemical nature of the substance. We use the same principle here to look at the nature of the substance within the body, and choline, which is part of the cell wall, which is the phosphocholine, represents here as the tumor. And it's used very commonly to diagnose cancer from infection, just to highlight how much in-depth radiology has gone. Next come, you might have heard very commonly these days people talk about PET scan. उन्होंने PET scan करवाया. PET scan is different from rest of the radiology because PET scan is using higher energy radiation to look at the metabolism of the inside the body. So this is the first PET scanner machine. Dr. David Cole is the father of PET scanning. And what we do in PET scan is that we give the FDG, which is the fluorodeoxyglucose, into the body, and it goes into the cells and it is metabolized there. And using this technology, we can look whether it is the function of the body, the cancer inside the body, the spread of the cancer, and etc. So look at this image and how nicely it is representing the whole body. This is the PET normal CT scan, and this is the colored PET fused on it, and it can tell the whole metabolism, what is happening, which cell is hyperactive, which cell is less active. Even PET scan has been used to pick dementia, Alzheimer's. So this is a normal brain. You can see this colored brain, but this is a dementia brain. ब्लड सप्लाई कम हो गया है ब्रेन का, तो वहां पे ऑक्सीजन कम है, वहां पे ग्लूकोज कम जा रहा है. So this is represented by using PET technology. PET technology has changed cancer. Look at the amount of cancer present in this patient with picked by PET technology. And after giving chemotherapy or treatment, the patient has responded very well. This is the real-time application. Not only that, sometimes patients are diagnosed with cancer, and during their course of treatment, they go through several PET scans, and it shows progression. माने कि कैंसर बढ़ गया है. So कैंसर की ट्रीटमेंट को जांचने के लिए एंड कैंसर की प्रोग्रेशन को ढूंढने के लिए दोनों जगह पेट का बहुत इंपॉर्टेंट रोल है. पहले हम फिल्म बेस्ड रेडियोलॉजी देखते थे. आप देखेंगे आपको एक्सरे मिलता है, फिजिकल एक्सरे दिया जाता है. बट अभी टेक्नोलॉजी इतनी बढ़ गई है और एक्सरे रखने की कैपेसिटी नहीं है. सो हम लोग पैक्स सिस्टम जहां पे डिजिटल रेडियोलॉजी हो गई है, हर चीज, जैसे आपने हमारे टाइम पे हम लोग वॉकमैन और सीडी मैन सुनते थे, अब लाइव स्ट्रीमिंग चालू हो गई है. सिमिलरली रेडियोलॉजी भी storage of the images has also changed significantly. So a lot of thought has gone into how to store large amount of data, and everything is converted now into a digital format. This can stay for a long time. सालों तक आप इस डेटा को रख सकते हैं. पेशेंट की जर्नीज फ्रॉम द बिगिनिंग टिल द एंड, यू हैव ऑल द डेटा टू सी. और नहीं तो पहले जब व्हेन आई वाज स्टूडेंट, हम लोग फिल्म लगाते थे और हम व्यू बॉक्स पे देखते थे एक्सरे को. अब हम कंप्यूटर पे देखते हैं एंड इट हैज इंप्रूव्ड सिग्निफिकेंटली आवर आउटपुट. और नॉट ओनली दैट, विद दिस डिजिटल रेडियोलॉजी आप किसी जगह पे बैठ के कहीं और का स्कैन रिपोर्ट कर सकते हैं. जैसे रूरल एरिया में सीटी स्कैन तो चला गया, बट डॉक्टर नहीं है वहां पे, तो क्या करें? अभी वहां से वी कैन डू द सीटी स्कैन, डू द एक्सरे. This mobile X-ray units, the mobile mammography units go to villages and they take mammograms, X-rays of the patient. They are transmitted to the main hub center, and there all these scans are reported, and that is teleradiology, which has again changed world so much that a scan done in India can be reported in the UK, a consult can be done outside the country. These all things are possible now. Another important field, which is interventional radiology, which I would call as minimally invasive surgeon. ये एक ऐसा सर्जन है, रेडियोलॉजी की फील्ड है, जहां पे हम बहुत छोटी ट्यूब डाल के बहुत बड़ा काम कर रहे हैं. So we don't operate the patient, we don't cut the patient, we use one of the arteries, femoral artery, one of the veins, and we go inside the body using a thin tube, and that tube is seen through this X-ray equipment all throughout, and then we treat. So this is a typical example. You can see the size of the tube. It is so thin, it goes into the artery, it goes into the central nervous system, and if there's any block in the heart or central nervous system, you can treat with this. And this is how I'm showing some examples over here, the animated videos, how the small pipe goes in. If there's a blockade, you can inflate a balloon and open the blockade. If the blockade is bigger, you can put a stent inside using this tube, and that is done by interventional radiologist. I'm going to touch very briefly on artificial intelligence, machine learning, and deep learning. These are newer things which I think many of you are now coders. You will change the future of India and radiology and medicine and science. I'm sure many of you would be doing this in the times to come. So artificial intelligence is something where the computer is thinking like human. The computer is made to think like human. The only thing is this computer does not cry, laugh, or say, I'm tired, I can't work more. And that's the novelty of this machine learning. So it is never tiring. And then machine learning is any algorithm which you develop using this artificial intelligence. It can detect cancer. Machine learning is very well used in managing traffic, air traffic. How do you think so many planes are flying in the airspace? They are managed by algorithm. Every plane is tracked. Similarly, machine learning is also used in science. And they use something called as neural networks, which I will show now. So what happens if you have seen human body, there is a neuron, it takes signal, and this neuron processes the signal and gives to the brain. And similarly, in machine learning, the signals are taken and they are processed and an output is generated. And how a human reads an apple or a pineapple or anything, a child, when it starts getting oriented to a fruit, it understands the color, it understands the shape, it understands the contour, the orientation of an object. Similarly, a neural network also divides any object into small pixels and then understands the object. So things have changed, and we have used neural network to diagnose cancers, even to detect COVID. This was made very possible by this upcoming science. And I myself, I'm very heavily involved into deep learning and artificial intelligence. I think it is going to change the world of radiology and medicine as well. We can even diagnose cancers. We have been participating in many challenges. India was one of the teams to win this international challenge in 2018, my team with my colleagues. And not only that, we have published several work in artificial intelligence, and that is novel to have done from India where the resources are limited. So I think science has progressed so much that it's not only from the beginning, from X-ray tube, now we are creating humanized models which can think like human. With that, I thank you for your patient hearing. I hope you enjoyed this lecture, and I think I have a good amount of another 10 to 15 minutes to discuss with you. I'm happy to take questions if there are any. And again, thank the CIET for giving me this opportunity. You have my Twitter handle here. If you have any questions, you can tweet it to me. That's my mobile number and that's my email address. It was lovely talking to you all, and hope you had a wonderful time.
Thank you very much. Thank you very much, Abhishek. It was wonderful listening to you. We really enjoyed. Now, your permission, can we start some questions? So first,
yeah, sure.
Dr. Mohit, please.
So, Dr. Abhishek, a wonderful presentation and really enriching. I'm sure that our students who are listening today, and not only the students, other colleagues who are listening would have been really benefited by it. While listening to your presentation, I had a small doubt. Do we use the same radioactive source C14 for all diagnostic and interventional radiology?
No, so for we use tungsten as cathode and anode, and that it's heated, and once the tungsten is heated, it emits electrons, and when these electrons hit against the cathode anode, it gives X-ray radiation, and that's the principle in X-ray. In PET scan, we use the fluoride 18. It's something similar to carbon dating as well, the C14.
Okay, okay, thank you.
So, Dr. Abhishek, there are some questions related to researches in interventional radiology. Friends, just for completeness, the NMR means nuclear magnetic resonance, which Dr. Abhishek, yes, NMR imaging, and PET is positron emission tomography technology. Yes. So the question is that in X-rays which expose largely to many portions of the body,
Yes.
and therefore it is being considered that first imaging should be done through X-ray films, not by CTs, which involves more exposure to the body. And what happens in the case of MRI in contrast?
Okay, so it's a very, I really appreciate this thought who has put, and I should have, it's called, we call it that image wisely. It's a very important technology. Just because technology is available does not mean that it should be misused. And this candidate has very rightly said that the first point of contact should be the most easy technology. What can be done by ultrasound is the best because it does not have any ionizing radiation, and where possible use X-ray rather than CT scan. So if there's a fracture, we don't need to do a CT scan. X-ray is enough. MRI has very specific roles, and we give different contrast. I will highlight now, since I have time, I can tell a bit more. So there are different contrasts in different systems. In X-ray, we give barium. Barium is a compound which has similar wavelength to close to the X-rays, and it is blocked. In CT scans, we give iodine, which is a contrast, and in MRI, we give contrast, which is called gadolinium. Gadolinium is an element which is paramagnetic. It behaves differently in magnetic field, and this contrast is used in MRI. All these three contrasts are different, and contrast imaging is very important in radiology. It helps to understand what is happening. What happens in contrast is when we inject through the artery or the vein, the contrast goes inside the circulation, and anything which has blood vessel will become bright or lighted up. So this contrast helps to pick any vascular structure or any structure which is supplied by blood vessels.
Yes, I can understand it. Well, I hope that the person who has asked the question should have also gone through it. Then in this processes of X-ray interventional technology in particular, nowadays there is an emphasis on lasers, that is X-ray lasers, which operates in the water window, that is around 434 nanometer to 230 nanometers. And it is being said in magazines that once these devices are developed, we may be able to have in vivo investigations as well as procedures.
Yeah.
How do you talk about it?
Yeah. So this is again a very advanced technology. It is called as gamma knife surgery. So in the shorter wavelength has higher penetration, and gamma rays are used in this. This is a bit of therapeutic radiology where you use radiology to treat the patient, and this is specifically developed for brain tumor and small cancer. So you image the patient and use gamma knife as a knife to operate on the patient, and you don't have to open the patient. No scar, no incision, we don't open the body. We use gamma rays, and that's the concept behind using this technology. Apart from this, since somebody has asked, I would highlight even high frequency ultrasound waves and high frequency magnetic rays are also used. So it is called as HIFU, that is the high frequency ultrasonic rays, and MR HIFU. So uterine fibroid or prostate cancer can be treated using this. You don't operate, so no scar is given. Prostate is within the body. We used these high frequency magnetic rays. What they do is when they go inside the cell, they generate lot of heat, and when this heat is generated to a certain amount of temperature, the cell bursts. So what we do is we localize or we identify the area we want to treat, and we constantly focus on it and start giving this high frequency radiation, and it explodes the cell, and then the cell dies in that area. So this is a therapeutic form of radiology which is also available.
Yes, this happens in radiation oncology as well, I believe.
So the gamma knife is part of radiation oncology, but the HIFU, the magnetic and the ultrasound is part of radiology.
Part of radiology. Tanvi, you had some questions? I will take on later.
Since you said radiation oncology, I would like to highlight this terminology here for my audience.
Please.
That radiology is different from radiation oncology. Radiation oncology is a field which specifically use X-rays in different form. They are not called X-rays, they are different rays to treat a patient of cancer. And we are radiologists who image or diagnose diseases. So these are two separate fields for the audience to understand. It's a very common thing when I was a child, when I was studying, and I would say I'm a radiologist. Some people in my town would say, "Oh, aap radiation karne wale hain kya?" So, or the other thing, common word is used, "Aap photograph lete hain kya?" So,
yes, you do.
We are modern photographers of the human body, but this science has developed a lot. Yeah, Tanvi, you have this.
Yes, so before I raise my query, just want to congratulate. It was a wonderful presentation, and so now I know that what a radiologist does, and that's how you began. So in the first picture of the X-ray which you showed, there was a lady and she was wearing a ring. But generally, when we go today to a radiologist for the X-ray, we are asked to remove all our jewelry.
Yeah.
Even for the MRI or CT scan, we are asked to remove the dentures, and even somebody is wearing a hairpin, that is also asked to remove. So why are these metal objects harmful for the machine?
So this question brings some, I think I have time, so I will explain. So whenever we go for any diagnostic imaging, थोड़ा कुछ चीजें ध्यान में रखिए. Any female patient who's pregnant is not supposed to have radiation, because radiation is harmful. So whenever we have a female patient in our department, the first question we ask is, when was your last periods, to understand that patient is pregnant or not, or we ask, do you think you might be pregnant? And that's a very important thing, because the fetus inside the body is very sensitive to any form of radiation. Hence, for fetal radiology or बच्चे की जांच करने के लिए uterus के अंदर, we use only ultrasound. We don't use any ionizing or MR radiation. Even MR radiation, the magnetic resonance imaging, also has a capacity to increase the heat within the cells, and the child who's the fetus inside can have damage. So it's very judiciously used. The reason I'm saying is, there are some female patients who are pregnant and land up in situation where CT scan is required. Then it is benefit versus risk ratio. We explain to the patient. But for routine diagnosis, we don't use any thing. Apart from that, males, we don't do anything. There are no precautions for doing any examination. They can come directly to the diagnostic radiology room. We remove all these, we ask you to change to normal clothes without any pins or clips, because these pins and clips can obstruct the lesion or the area of interest and can reduce the quality of the imaging, and also they don't cause any harm. In the CT scanner, or in X-ray, they don't cause any harm. But in MRI, we check for many other things. So in MRI, we check if the patient has any implant, any fixature, any metallic object inside the body, any pacemaker, any form of metallic cochlear implant also. We ask these things because they are magnetic and they can come out of the body. The pacemaker can start behaving differently inside the magnetic field. So for CT scan, we just ask to change clothes. For MRI, we ask whether you are not having any form of metallic object inside the body because it can alter. So it's very important that before you go for MRI, you make sure that there is no metallic. Even mobile phones, if you take credit cards or any debit cards, the magnetic reader is lost, they stop functioning. So magnetic field is very important. Now it comes a question, if we are using such big magnets, how do we protect our radiologist? Or if we are using such ionizing radiation, what happens to the radiologist over a period of time? Nobody thinks about it because patient is really worried that I am being exposed to X-ray. I would like to highlight two things here, that diagnostic radiation does not lead to cancer. There is no risk, and I have published my work when there was COVID. A lot of rumors were there that doing CT scan can lead to cancer. No, they don't lead to cancer. It's my work. My research says myth and mithya of radiology. It does not lead to any cancer. There is no proven risk but radiation oncology, when they give radiation, that can lead to cancer. How do we protect ourselves? We use lead aprons. Lead is a bad conductor of X-rays. So when you see a glass at the CT scanner and the doctor is sitting on the other side and the patient is inside, the glass has lead within it, and that lead within the glass protects the radiation to go constantly to the doctor who's sitting on the reading side. Similarly, magnetic radiation also has glass. Like we use, MRI rooms have glasses, so they have Faraday cage which has copper wires, and they do not let the outside. If you have a radio outside the MRI room, it can actually interfere with the MRI inside. So the radio frequency of the radio or mobile phones can interfere with the radio frequency within the MRI room. But this Faraday cage all along the room protects the magnetic rays from inside to outside and outside to inside. So this is how we have. I hope the
Yes.
background I have explained.
Yes, Anand.
Yeah, Dr. Mahajan, at the onset, while going through your CV and the way you are explaining, I wonder, do all doctors have this research bent and they go into this depth? You have published so many research papers, as also been part of so many trials. So what motivated you towards a research bent of mind as well as research field in this? Could you please share your thoughts for the benefit of our students?
Yeah. I come from a very traditional background, from a very small town. I'm from Pathankot. It's a small town, and I'm privileged that my parents gave me this opportunity. What motivated me while being a student at medicine, I had mentors, my professors, whom I would live up to, and there was a huge gap I saw, because what we saw in our small town where there was no medical college, I would see private practitioners, and they were doing service to the mankind at the periphery. But at the medical college, now you are seeing that there are less number of people who want to be a teacher. There's less number of people who want to actually, everybody is rushing towards making money. The moment people finish their MBA, medicine, engineering, they want to go to higher, bigger companies, more money, better future prospects. I come from a family where even I thought, like when I was doing radiology, it's a heavily paid branch. The salaries are really good. I dreamt of having a big car. That was my dream.
Yeah.
That dream changed, and I joined Tata Memorial Hospital, and I still remember my first salary was 14,000 rupees. In 2009, I think. but the motivation was the patient service, and I would say Tata Memorial Center is one of the leading cancer centers. I always wanted to work there. Once I reached and I saw the senior colleagues and professors and how much dedicated they were with those little salaries. So I think the research became my dividend
Passion.
and my return. So either you get money, money makes you happy. My research made me happy, and I strongly anybody who wants to know further about research, I'm happy to discuss with them offline. But it's very important. You need to give back what you've got, and it's a very important thought. What one of my professors, Dr. Rao, said that you've taken from the system. It's time to pay back. So everybody should do some kind of, and as you guys are doing this payback to the community, it's very important. If every doctor will just start doing private practice, then the research would fail. So it's very important. I request all students to, whichever field you take, you remember that you take from the system and you need to give payback to the system as well.
Yeah, very rightly said.
Thank you, Dr. Abhishek. We really enjoyed listening to you. We still have many questions which are, some questions are very common and some are research oriented. We will address, hope to address all those questions in a subsequent session when you are in India and when you are in our studios here. So now we are running a little short of time. So viewers, please send your questions, queries to our email addresses, and then let me please just inform you what next. On 10th of February 23, we are going to have Pawanji Agrawal in our studios. I hope you can identify, you can recognize his face. He is all in all at this moment in Mumbai's Dabbawala session. So he will be speaking with the title, Let's Touch the Sky, Lo Chulo Asman. So Dr. Mahajan, we really thank you for being with us. We thank Clutterbridge Institute, University of Liverpool, for collaborating with us in this program, and we look forward having more collaborations in future. Tanvi.
Thank you so much. Thank you, sir. Thank you, Dr. Mahajan, for being with us for this wonderful presentation, and each and every word you said, be it a science student, be it a non-science student, we are all interested. Thank you so much. Thank you so much, Gagan sir. Thank you so much, Dr. Mohit, for being with us. It was a wonderful program, and it was a pleasure having you. Thank you.
Thank you.
Thank you to all our viewers for being a part of this program. I really think that you have enjoyed it. If in case you have missed this program, please watch it anytime you want on our YouTube channel, which is NCRT Official. And like Dr. Gagan Gupta announced, the next program will come very, very soon. And the topic would be Let's Touch the Sky, the story of Mumbai Dabbawalas. Well, who doesn't know these Mumbai Dabbawalas? So the story would be very, very interesting. Do watch that program. And now we're signing off, but of course, we have to tell you that at 11, Pariksha Pe Charcha will begin. The program where Honorable Prime Minister Shri Narendra Modi, he will be interacting with the students, with the teachers, and with the parents. And this program will be live on Doordarshan and all the major channels of Doordarshan and All India Radio, and also on Evita channel number 1 to channel number 12. So he'll be sharing his life mantras and how you can manage your stress during the exams, and also how you can make pariksha or exams as an utsav. So please watch that program, and we are leaving with that. We have one more announcement for all of you, that is regarding G20 presidency, and we are very proud that India assumed G20 presidency, and of course it will convene the G20 Leaders Summit for the first time in the country this year. So all the very best for your examinations, and thank you so much. We're wrapping up this program. Namaskar, take care.